Welcome, my friends, to the Bob and Brad podcast produced by Bob and Brad, the two most famous physical therapists on the internet. My guest today is Dr. Ben Thompson, and he is going to speak to us about tinnitus or tinnitus, and we're going to get all the answers that you need. Welcome to the show, Dr. Ben Thompson.
Glad to be here.
Yeah.
Glad to be here, Bob. I've been following you for a while. I'm so glad to be a part of the Bob and Brad show.
Well, we're super excited to have you because we have many people inquire about tinnitus. So a great topic. I mean, really, a lot of people are suffering from it. So can you first give us your backstory, a little background?
Absolutely. My name is Dr. Ben Thompson. I'm an audiologist based in Northern California. I initially became interested in sound and hearing with my personal love of music and hearing protection and understanding how sound, which we love, can also damage our hearing and lead to adverse medical conditions. I completed my graduate program, Doctor of Audiology and Audiology residency in San Francisco at University of California, UCSF. At that place, what I learned at the university hospital was that tinnitus, also pronounced tinnitus, is a very underserved condition, and it affects millions of people. The treatments, the management strategies, the solutions do require expertise, and I was fortunate enough to build up that expertise, eventually starting a YouTube channel, educational information for tinnitus and hearing loss, and then eventually starting a company, Treble Health, which provides online telehealth services for those conditions.
And that's your website too, right?
That's correct.
Treble
Yes,
Health.
Treble Health is our company. That's how we help people with tinnitus.
And your YouTube channel is Treble Health, right?
That's correct. Yes, a young YouTube channel compared to your tried and true long time Bob and Brad.
Unfortunately, we've been a long time. Yeah. So we've got questions from our followers on Facebook, and then we got ours. So we got a lot of questions. You already mentioned tinnitus is in the millions. Is that, do you have a certain percentage of people that get it, or?
Yes, I do. Yes. So the research in the United States has shown that between 10 and 20% of the population has tinnitus.
Oh my God.
And what we need to specify here is that for most people who experience an occasional ringing, buzzing, hissing sound in the ears, it's not a problem, right? There's certain conditions or certain phenomenons that happen in the body that are not necessarily a disease or something that we need to fix. And for most people with tinnitus, it's something that's not bothersome, but they notice it. However, for 10% of people who have tinnitus, it is very bothersome. And there are not so many solutions out there. There's not so many medical professionals who are well-trained in how to improve tinnitus as well.
Is it considered a disease, or is it a syndrome, or
it's
what?
Considered a symptom, actually. It's
considered. Sure. Gotcha. So you kind of alluded to the fact what it sounds like, but what are some of the suspected causes of tinnitus?
For the most common cause of tinnitus, we have hearing loss, whether that's age-related progressive hearing loss or noise-induced hearing loss from gunfire, loud noise exposure, concerts, music, power tools. That can have a long-term, long-tail impact on hearing, which can lead to tinnitus. So the most common representation is, first I have a hearing loss from some cause, and then because of that, the brain creates this phantom sound response, which is tinnitus. So tinnitus is the most common symptom of hearing loss. There are other medical causes to tinnitus, and it's important for those listening or watching who have tinnitus to remember there is not one tinnitus. There are different causes and different treatments and management strategies depending on the cause. The other common causes are stress-induced or stress-related tinnitus, where the nervous system, the central nervous system, can be so built up that it releases this high-pitched sound as an effect. Additionally, TMJ, jaw concerns, and upper neck asymmetries can lead to tinnitus and can have medical treatments.
I think we touched upon that later, but can a head injury cause tinnitus?
Concussion, head injury, can cause tinnitus neurologically in the brain, as well as that a head injury can cause a hearing loss in the ear and the bones around the ear, which leads to tinnitus. And finally, a head injury related to the neck can cause tinnitus with the source in the upper neck. So as we see here, it's important to know the details,
right,
because
get it checked
if
out.
someone misses one of these potential causes, then we might be missing the very treatment that could help them.
Here's a Facebook question. Does this symptom increase your chance of deafness or hearing decline?
Really, really important question. Really important question. My team of audiologists, hearing and tinnitus specialists, and we have a lot of telehealth conversations. We talk with a lot of patients. We have a lot of counseling and consultation as well. And a common fear is that tinnitus will get worse over time, because if I can manage it now, I don't know what will happen if it gets louder and more out of control.
Right.
Well, here's the important point for everyone to know is that your hearing, Bob, my hearing, everyone in our family's hearing, it progressively gets worse as we age. It's one of the 5 senses that progressively declines over time. We can't stop that.
Sure.
That's inevitable. Tinnitus, however, even though it is related and correlated to hearing loss, does not inevitably get worse over time. In fact, it often gets better over time.
Great.
Because the brain is able to defocus from it when it knows that it's a neutral signal and not something that causes a reaction or us to pay attention to it. I can explain more on that later.
Sure. Another Facebook question, does high blood pressure make tinnitus worse?
It can be associated with a tinnitus spike. A tinnitus spike is considered when there are hours or days of my tinnitus getting loud. And I personally have tinnitus, so I understand how it feels. I understand how it sounds. I understand that it can go up and down. The question here is, can cardiovascular changes, high blood pressure, change tinnitus? In the short term, yes. In the long term, usually not.
Gotcha. So you kind of alluded to this already. So can cervical stenosis or bone-on-bone grinding in your neck cause tinnitus? It
can. And in the Treble Health podcast, our podcast, one of the best interviews and most popular interviews we've had is of an ENT, ear, nose, and throat physician, medical doctor, who did clinical research into the causes of tinnitus. And through that conversation, we learned that upper neck conditions can be one of the causes of tinnitus.
Gotcha.
Having an osteopath, having a doctor of osteopathy, or someone of similar skill level evaluate for upper neck asymmetries, as well as looking at imaging studies of the bones and how they're operating, that could give us a clue into what is the cause of your tinnitus. So the answer to that question is yes.
Does inflammation play a role?
What kind of inflammation do you think
they ask?
To?
I'm not sure.
Yeah. So when I hear inflammation, I think of a few things. I think commonly in the health world, there's definitely topics on inflammation related to diet, how certain foods can have an inflammatory response. In the short term, that can be related to increases in tinnitus, but usually diet, salt, sugar, caffeine, usually that's not the primary driver, nor is it responsible for why someone has tinnitus. Other kinds of inflammation could be inflammation of the ear and the hearing system, like an ear infection or swimmer's ear. Yes, that can be related to temporary changes of tinnitus. And then there's more neurological inflammation, which is a bit more sophisticated. So the short answer is yes, there is a relationship between inflammation and tinnitus. Yeah.
So you also talked about this, but is it ever a problem with the ear canal, or it's your hearing or the brain? What is the main cause?
Yeah. I wanted to ask you, Bob, actually, have you had a hearing test yourself?
Yes.
Okay, very good. So from that test, which is performed by an audiologist, and the best way to get that test is at an in-person clinic. There are also online screenings for those who are curious.
Right.
Through that test, the audiologist, I myself am an audiologist, can review the 3 parts of the hearing system to understand, number 1, do you have a loss of hearing? And if so, what part of the hearing system is responsible? there are issues related to the ear canal, earwax, ear infections, problems with the eardrum, etc., that are medically caused, medically treated. And those can be improved. And the treatment of those conditions that are related to a temporary or treatable hearing loss, that in and of itself can reduce tinnitus by 50, 80%. So
Oh,
that's
wow.
definitely the first line of action.
Sure.
If you came to us and said, I have tinnitus, what should I do? We would say, let's rule out a medical cause related to earwax, ear infection, hearing loss. And then once we get that data, we're more able to specify the treatment from there.
Oh, wonderful. So, um, what are the common symptoms? I mean, beyond the hissing, buzzing, ringing. I mean, people have trouble with sleep, and so I'll let you go for it.
Absolutely. You were right on the money there. So the common symptoms of tinnitus is a noise in the ear, such as ringing, roaring, buzzing, hissing, whistling, and that noise may be intermittent, coming and going, or continuous. Now, it's important for those listening who have the condition to remember that this is most often a neurological sound. This is a phantom sound coming from the auditory cortex, the auditory brain. This is not a permanent change to the structures of your system.
Sure.
Tinnitus often gets better and can improve over time with neuroplasticity, with the brain's ability to change. So whether it's coming and going or continuous, it can often get better. And that's, of course, what we all want for this.
Right.
Most of the time, the person who has tinnitus is the only person that can hear it, meaning that I have tinnitus, but if you put your ear right next to mine, you wouldn't hear it. It's a subjective internal sound. It's also invisible. There's no marker on my ears or my body to show anyone around me that I have it. So as we can see here, this is a rather mysterious and complicated medical condition with all these causes, all these different manifestations. As you had spoken about some important things, if I develop tinnitus and it's bothersome, that means I'm struggling to concentrate. That
Right.
means I have stress and anxiety. That means I have fear most often, because the future is a bit unknown unless you have a guide to show you what's going to happen in your
Right.
future and lead you along the way. So troubles with sleep, insomnia, anxiety, stress, depression, often that's what occurs in the first few months of someone developing sudden onset bothersome tinnitus.
Sure. And I could see it snowballing. I mean, so when should you see a doctor?
So in my opinion, right away, as soon as possible, you should see a doctor for tinnitus, because it usually comes up, and the earlier we do something about it, the better the outcome. So as we know in our professional circles, early intervention with almost any health condition is better. And for that reason we talked about earlier, particularly having the most obvious and easy to fix problems ruled out first so we can focus the treatment. If someone develops sudden tinnitus, get a hearing test through a local clinic,
Sure.
consult an ear, nose, and throat doctor to rule out any medical concerns, and simultaneously working either on your own or under the care of a tinnitus specialist to start implementing the strategies that help you manage this, the anxiety, the stress, the insomnia, and the ringing and the concentration. We don't want to wait for any of this. Yeah.
Right. Why? Is there any hereditary component to it?
There's not a hereditary component directly with tinnitus. Tinnitus is a symptom most commonly of hearing loss. There are different forms of hereditary hearing loss, meaning if your parents, one of your parents, your grandparents have an earlier onset of hearing loss, then you could be at risk to have the same, and in which case you may develop tinnitus because of that.
Sure. Gotcha. I think you answered this question already. So someone asked, they said their hearing loss is getting worse, and they know the brain is trying to make up for it for a certain loss of hearing range. So they want to know, will it get louder as your hearing gets worse? And you said no, right?
And most often, no. Most often, hearing gets worse and tinnitus gets better.
Gotcha.
Now, of course, there's some assumptions here that you're following the right systems of how to manage tinnitus,
Right.
that your brain ear connection and your nervous system is set up in a way to promote what's called habituation, which I would love to explain. Habituation for tinnitus means over time the brain can reduce the symptom in the intensity and often the loudness. Now think about this, everyone listening, and Bob, just take an in and out breath with your nose, in and out, just normal speed, normal rhythm. I hear a sound. Most people hear the sound of their breathing once they're focused on it. Yet during the day, unless I ask you to think about that, I'm never hearing the sound of my own breathing. So this is an extreme example of the brain's ability to habituate a signal
Right.
that's
Absolutely.
constantly there, but can be reduced over time. And for you all in the physical therapy world, the way that you may manage chronic pain is very similar to how we would manage
Right.
tinnitus.
Exactly.
Mhm.
So, are there any relationship between allergies and tinnitus?
So allergies affect the nose, the ears, the throat, the eyes. The sound pathway goes from the ear canal to the eardrum, and then the cochlea, which is the second smallest organ in the body behind the pineal gland. Once the sound can pass through all those systems and it gets the green light from all those systems, then someone should have no problems with tinnitus or no problems with hearing in most cases. However, allergies can affect my eardrum through an ear infection or inflammation of that region, and that can create a temporary tinnitus related to the allergies, or it can change the baseline level of tinnitus.
Sure, gotcha. So, any specific medicines that can cause the side effect of tinnitus?
There are many documented medications that can cause tinnitus. Now, for those who work closely with tinnitus individuals in our community, we know that there's actually so many things that can spike tinnitus. It's a sensitive medical condition, and sometimes it's referred to as the barometer of our nervous system, because if things are out of balance, it can get louder. If I'm stressed, it can get louder. If I take a certain medication, it can get louder. So my response here is, yes, there are certain medications that can cause tinnitus. The most extreme ones are not common, and those are medications that are used during chemotherapy or medications that are in the mycin family. That's not something that the average person would take, and it's definitely not something you can take over the counter.
Right.
You know, so with that in mind, of course, if you're considering whether your medications are affecting your tinnitus, speak to a good audiologist and speak to a good physician who can take a full inventory of what medications you started to see if that lined up with the onset of an increase in your
Sure.
tinnitus.
Makes sense. So, a Facebook question. My tinnitus seems to get worse at night. Is it my imagination or is it possible?
It is possible. In our community, there are certain manifestations or changes to tinnitus that we may not have a physiological explanation as to why that happens. However, we do know certain things can be par for the course with living with tinnitus and managing it. One of those is that waking up after sleep, for example, in the middle of the night or after a nap, tinnitus levels, the baseline level of tinnitus seems to be much higher. That's something that
Mm,
does happen to a lot of other people. And as
sure.
someone myself who interfaces with this community a lot, I can validate that is something that can happen. There are strategies and methods to respond to that so that it doesn't affect us so much. There's not necessarily a physiological error or abnormality that needs to be worked on because of it.
Very good. So, four people were interested in this question. Is there any evidence that water retention from excessive sodium intake worsens tinnitus?
There is not strong evidence to suggest that increases in sodium are linked to increases in tinnitus. That's at a population level, however. And for individuals, the way that sodium interacts with their body and their nervous system, their tinnitus, salt can spike tinnitus on an individual basis.
Gotcha.
So if that's a concern or if one is wondering, then we can guide them, or they can be under supervision to restrict their salts and monitor to see if that independently can be linked to changes in tinnitus. Overall, at a population level, you can enjoy salt, you can enjoy sugars, of course, in moderation. You can also enjoy alcohol, and that's not, you can still get better with tinnitus while using any of those substances.
Gotcha. So I think you talked about this already, are the subtypes?
The subtypes are classified. There's three major subtypes that make up about 80% of the causes of tinnitus. And if you're in one subtype, it does not mean it's exclusive. You can have multiple factors here at once.
Gotcha.
The most common would be hearing loss. The second would be stress-induced. And the third would be what's called somatic, typically related to the jaw or the neck. There's also other cardiovascular conditions that can cause tinnitus, and a whole other list of potential causes, but those make up the most three. And the most common example that we see at Treble Health, at our telehealth company, is that when someone has a slow progressive hearing loss, where they're maybe noticing a little difficulty hearing, maybe they're between 40 and 65, 70 years old, maybe they're noticing some slow progressive hearing loss, but what really rocks them is that suddenly out of nowhere, the ringing sound in the ears or the brain increases, and it stays there for a matter of days, weeks, or months. And that's a common subtype where, yes, there's two factors involved. Most often it's the progressive hearing loss plus stress-induced nervous system reaction.
Gotcha. So someone talked about pulsating tinnitus.
Yes. Imagine that you hear the sound of your heartbeat vibrating in your ear, whether it's one ear, both ears. Maybe you already had some ringing before that, and now it's vibrating and synchronized with the heartbeat. That's called pulsatile or pulsating tinnitus. And it's often linked to cardiovascular conditions related to veins or arteries around the ear, around the neck, around the head. We need a comprehensive medical workup to take certain tests, to have a well-trained physician look at the potential causes there from the cardiovascular system.
So that's really not typical. I mean, it's not part of the three that you mentioned.
Correct. It's not typical. It's a small minority of the overall cases of tinnitus, and it is one of the types of tinnitus where it can be potentially something serious. So definitely a good idea to have it.
Want to get checked out, right? Does tinnitus generally come on gradually, or does it come on all at once?
For the population, it comes on gradually, and this may be after going to a lot of concerts. You start to notice a little bit more and more that you were hearing some ringing when you were in a quiet place, maybe trying to fall asleep at night or in a quiet room. And that's usually more manageable, because when it's relatively low, relatively soft, slowly progressive, we can work on it, use resources, reach out for help if we need it. The minority of cases come on suddenly and go from a 1 out of 10, or I never even heard tinnitus before, up to an 8 out of 10 intensity, affecting sleep, stress, anxiety. That can really change someone's life overnight.
Right.
And of course, we're kind and compassionate in this field, because it's a rather hard symptom to live with, let alone, work at and improve, which is possible. And we're really proud to help people improve this condition, which, quite honestly, Bob, what happens a lot, and what's part of our mission to change, is as individuals develop sudden tinnitus, they go to the ENT, ear, nose, and throat doctor. Many ear, nose, and throat doctors are not well trained in all of these nuances that we're talking about, surprisingly, because there is no medical cure for tinnitus. However, if I come in sudden tinnitus, it's an 8 out of 10, and the doctor tells me there's no cure, you just have to live with it, that sets off the
anxiety,
sets off the limbic system. Anxiety, fear, stress just got worse.
Lack of sleep.
What we know in our field as audiologists is that it can go from an 8 out of 10 tinnitus level down to a 2 or 3 out of 10 in a period of months. And that's probably very similar to some conditions you work with in the physical therapy pain
Right.
domain, correct?
And then it becomes manageable. So-
Correct.
And Dr. Thompson, you come across as a very caring individual. So, um,
Thank you.
so is this often in just one ear or is it both ears?
It's often, it's most common perceived as both ears or center of the head.
Gotcha.
And the source is the auditory brain. The auditory brain is creating this phantom sound response because most often the ears are not passing all the signal through that they used to. So think about phantom limb. When military veterans, for example, lose an arm or a hand, and they can perceive sensation, they can perceive pain and feeling of that hand or arm that was,
exactly.
and that's coming from the brain, the
Right.
high
Pain.
level
Right.
brain. Similar thing, if you're losing a bit of your hearing, soft, high pitched sounds, clarity of speech isn't what it used to be, then the brain itself creates this phantom sound response, which is a high pitched sound that you only hear in soft places. So there
Sure.
is that correlation. And hopefully that helps the audience understand that this is not only an ear phenomenon, but also a brain phenomenon.
Right. Well, Dr. Thompson, this has been a real pleasure. I'm sure we're going to help thousands of people. I mean, they'll have at least some guidance of where to go.
Absolutely. And that's our goal, is to provide information, education. We want to give as much free away as possible. Of course, there's always a benefit to having a one-on-one consultation or
Yes.
getting medical devices. And if anyone who's listening knows someone who needs help with those, you can find us at treblehealth.com.
Thank you very much for being on the show.
I appreciate it, Bob.
Have a good day.
Take care.